Hello, everyone. Good evening, and thank you very much for joining us for Lessons Across Generations, Survival and Wellbeing, as part of the René Cassin and Generation to Generation, Human Rights Through the Generations series. The series aims to trace development of human rights principles from the Holocaust to today, highlighting how historical experiences inform and resonate with contemporary issues. But I would first like to start by remembering Leslie Urbach, Zichronah Livracha, co-founder of Generation to Generation, and the motivation for this series. Leslie sadly died on the 24th of June, and her inspiration, dedication, and commitment to justice, dignity, and kindness will be deeply missed. My name is Mia Hassinson-Gross, and I'm the Executive Director of René Cassin, the Jewish Voice for Human Rights in the UK. Our mission, grounded on Jewish values, Jewish teachings, and our community's historical experience, is to promote and protect human rights in the UK. We operate in the intersection of community mobilizing, narrative change, and policy advocacy. We draw our inspiration from the Universal Declaration of Human Rights, drafted by our namesake, Monsieur René Cassin, in response to the horrors of the Holocaust. The declaration was the first expression of a global commitment to protect human dignity, demand accountability, and act when others need protecting. We work in very close partnership with Generation to Generation, also known as G2G, which enables the descendants and close friends of Holocaust survivors to share their survivors' experiences before, during, and during the Holocaust. Last year, G2G speakers presented to around 50,000 people across the UK, different ages and different locations, and their presentations evidenced the range of experiences and human rights abuses survivors went through before and during the Holocaust. Only last month, G2G marked its 10th anniversary. Tonight's event brings together perspectives across generations to explore an urgent and persistent issue in the UK today: access to healthcare. Yesterday, for those who don't know, marked the 78th anniversary of the NHS. Coincidentally, the same year Monsieur René Cassin first introduced the Universal Declaration of Human Rights. While access to health is often in the headlines in the context of policies and statistics related to the NHS, it is also a deeply human issue, as everyone has the fundamental right to the best possible health and the support to achieve it. This is true now, just as it was true 80 years ago. So to help us explore the importance of the right to health, I'm delighted to introduce tonight's speakers. We will first hear from Noreen Plen, a member of Generation to Generation, the daughter of Holocaust survivors, whose aim was to give Noreen, their only child, the best education possible, as she developed a career as a pharmacist here in the UK. Joining Noreen is Katrin McEntee, Strategic Lead Right to Health at Just Fair, a UK-based organisation which works to promote and protect economic, social and cultural rights as essential in creating a fair and more just society. And René Cassin is very proud to be a partner with Just Fair, making the case for everyday rights here in the UK. So, a bit of housekeeping before we start. We will hear first from our speakers and then move into a moderated discussion where you will be able to either write your questions in the chat or raise a hand and able to ask them in person. Please remain muted during our speakers' presentation. And just so you know, this event is recorded and the recording will be made available on the René Cassin YouTube channel after today. So without any further ado, Noreen, I would like to invite you to please share your presentation with us.
Thank you, Mia, and thank you for inviting me tonight. Can everyone see it?
Yes, Noreen, it's fine.
Program of killing. My family all came from Poland. They were displaced unwillingly from their place of birth solely due to the fact that they were Jewish. And very few of them survived the invasion of Poland by Germany on September the 1st, 1939. The arrow shows where my father's family came from. Here is a representation of my father's family. My grandfather was called Shire Kutz. He was a deeply religious man. He was a merchant. He was murdered during the deportation of the Jews of the town they lived in called Mielec in Galicia on the 9th of March, 1942. My grandmother had already died prematurely. Out of the whole family, there were 4 survivors. Uncle Moishe, who had emigrated to France in the 1930s but died young in 1949. My uncle David, his daughter, my cousin Scylla, and my father Jan are the main survivors. Now, an awful atrocity occurred only days after war was declared. It was the custom of the Jews to go to the bathhouse on the eve of every Sabbath or every Jewish holiday. On the eve of the Jewish New Year, which was the 13th of September, 1939, German motorcycles roared into town. They surrounded the bathhouse. They drove all the naked victims to the slaughterhouse next door. And they murdered them by pouring kerosene over them and setting them alight. And then they moved into the adjacent synagogue, which you can see here. They set it alight, and another 40 to 50 Jews lost their life like that. It was soon after this that my father Jan decided to leave town. He left with his older brother David, David's wife Erna, his 2 daughters Scylla and Hanya, and my father with his young wife Dora. Out of the 4 women, Scylla was the only one to survive. They left Mielec in a car. They ran out of fuel, so they left the women and children behind. And David and Jan proceeded on a horse and wagon, and they reached the Polish town of Lvov to find that it was under Russian control. Now, this was due to the Molotov-Ribbentrop Pact, a secret pact between the Soviet Union and Nazi Germany that was signed in August 1939, even before the outbreak of the war. It was a military and political pact to carve up Europe with a line down the middle of Poland following the 3 rivers, the Narew, the Vistula, the River San. This little dot here where my cursor is, you might be able to see, is Lvov. Now, Poland was invaded by Germany on the 1st of September, and it was invaded by the Russians from the east on the 17th of September. So I know by the time David and Jan arrived, Lvov was under Russian control. Now, they lived in Lvov for a few months before being separated. They were loaded onto cattle trucks. And these are my father's words that hopefully you'll hear now, read out by my son.
These are the words of my grandfather Jan. After 2 weeks, we were transported in cattle trucks deep into Russia, a journey that took 2 weeks. Conditions during the journey were terrible. 1 bucket of water was supplied daily for 80 people. There were no sanitary facilities and no ventilation. There was no space to sit or lie. Older people collapsed and room had to be made for them on the floor, increasing the congestion. We were only given a little bread, water, and sugar each day. Conditions in the labor camp were primitive, beyond my imagination, and I thought survival impossible. Temperatures during winter months dropped to 45 degrees centigrade, below zero, sometimes colder. And camp clothing was totally inadequate for these awful conditions. Work continued 7 days a week. All inmates were given arduous physical tasks regardless of their health and strength. This included tree cutting in the forest and heavy laboring during the building of the Volga Canal. Malnutrition had a disastrous effect on many people, including the young. Death from exhaustion and starvation was not uncommon.
Now, prisoners were given a small ration of bread and a few cigarettes every day. My father had the will to survive. He was willing to swap his cigarettes for extra bread. This undoubtedly helped to save his life. It also gave him a lifelong hatred of smoking, because he saw men who preferred to smoke than eat, and of course they died sooner. Now, it was at some stage while he was in Siberia, and he didn't even know where he was. He never knew which camp he was in. My father was accused by the NKVD. They were the secret police agency in Russia dealing with law enforcement. A trumped-up charge, and he was sentenced to 15 years imprisonment. And this would cause him a problem later. Now, after less than 2 years, the Molotov-Ribbentrop Pact broke down when Nazi Germany invaded Russia. The Polish army was in exile in London, which is why you might recognize at the table Winston Churchill, Anthony Eden, and the Poles made a new pact with the Russians called the Sikorsky-Maysky Pact. And this pact helped my father in 2 ways. First of all the previous prison sentences handed down to Poles in Russia were declared null and void. And more importantly, there was an amnesty for all Polish prisoners on Russian soil, including the Jews. Now, it took time for news to travel, but my father was released in May of 1942. We think he went to a sanatorium because there's a gap in his history until 1944, when he'd obviously recovered enough strength to join an army. The Berlin Army was known as the Polish First Army. It was a branch of the Russian Red Army. And you know, more than 500,000 Jews fought in the Russian army. Their story is not often told. In this photo, my dad is a private. He was 35 years old, and the Berlin Army was one of the forces that helped to liberate Warsaw in 1945, at which stage Jan left the army and got a job working in the Ministry of the Interior. While he was working there, he met my mum. My mum became his secretary, and that's how they met. So how did my mum end up in Warsaw? Now I will tell you her side of the story. She belonged to the Waxman family. There were 3 children who all survived. My grandparents were murdered on the 23rd of November 1943. They were in a labor camp, and many other members of the family were lost. Marek survived because he'd left Poland in the 1930s. My mum, Lola, was 21 when war broke out. She was at university, and her younger sister, Lutka, had just finished school. They lived in a town called Lublin, where my mother, aunt, and uncle were born. They were born in rooms in this street called Grodzka. There's an arch at the end called the Grodzka Gate, and the Jewish area was on the far side. It was completely destroyed. It's now a car park. But, the family moved to Warsaw in 1934. My grandfather had a business importing tea and coffee, and they were very happy, but this existence was disrupted and changed forever when the Germans took over the city. Here you see the picture of a rundown building that became part of the Warsaw Ghetto. Ghettos were created during World War II to isolate the Jews from the non-Jewish population under very poor conditions. On October the 1st, 1939, only a few weeks after Warsaw fell, my mother Lola, her sister Lutka, and their parents were moved from their comfortable apartment to this rundown building that you see here. Jews were ordered to move with very little notice, and they couldn't bring many possessions with them. My mum and her sister were then forced into slave labor. They had to walk to work. Jews couldn't use any form of public transport, and they had to wear the white armband. From November 1939, all Jews in Nazi-occupied Poland had to wear a white armband, 10 centimeter wide, with a six-sided Star of David on it, and it was to be worn on the on the right hand sleeve of their outer garment. Later on, as more countries were occupied, the Jews had to wear perhaps the more familiar yellow star. This had to be worn on the left-hand side of the outer garment. The armbands, the badges, they were made to make the Jews stand out and be conspicuous and denote separation from the rest of society. One feature of the ghettos was overcrowded. This is a map of Barnet, which is where I live. Population 390,000. Jewish population 60,000. This coloured area is the size of the Warsaw Ghetto, 1.3 square miles. And at its height, it had 460,000 Jews in this tiny pocket. I think that demonstrates overcrowding. The Warsaw Ghetto was the largest of the ghettos in Poland during World War II, and the living conditions were appalling. Food, medicine, clothing, everything was in short supply. The Nazis allowed 184 calories a day for non-workers. This is the equivalent of one chocolate biscuit. So much of the food, 80%, was smuggled into the ghetto by young children. And despite this, many people died from starvation or typhus. My mum had had an anti-typhoid injection as a child. This helped to protect her. I also found out, I've got evidence that she applied to an American charity called the Joint, the American Jewish Joint Distribution Committee, and she applied for food parcels to be sent into the ghetto. How she managed this, I will never know. In July 1942, the Nazis started deporting the ghetto Jews to their death in Treblinka. It was at this stage that my mum and her sisters saw their two parents being loaded onto the back of a lorry. They didn't know where they were taken to, but as I've mentioned previously, they were murdered at a labor camp called Travniki on November the 3rd, not the 23rd, November the 3rd, 1943. Now, after their parents were taken, Lola and Lutka decided they needed to try and escape. They had been moved from the factory to a shop where they'd met a Polish lorry driver who had a putting potatoes into the ghetto. Again, I don't know how they did it, but they contacted the joint. This Polish lorry driver was paid to smuggle the two sisters out of the ghetto. So one day in January 1943, it took them a few months to organize, the two sisters were hidden in the back of an empty potato truck and driven out of the ghetto to the Aryan side, the non-Jewish side. Had they been discovered, all three of them would have been shot, but they made it. Now, I have to mention the Warsaw Ghetto Uprising. In April 1943, groups of young Jewish fighters, and these were teenagers, banded together and decided to resist. When the German army came into the ghetto on the eve of the Jewish Passover, on the 19th of April, 1943, they were attacked. They were attacked with stones, with whatever these kids had managed to get hold of. They turned round and they ran away, leaving behind machine guns, grenades, useful weapons. Basically, you had a situation where 750 teenagers fought off the might of the German army, who had obviously brought in reinforcements. They held them off for nearly 1 month until the Germans set fire to the ghetto, and had my mum and her sister not left in the January, they wouldn't have survived. Nobody survived. And this act of resistance is known as the Warsaw Ghetto Uprising. So what happened to the two sisters? Well, the Polish lorry driver drove them to a farm on the outskirts of Warsaw, where the farmer had also been paid by the joint to allow the two Jewish sisters to work on his land. The farmer's wife, helped them to dye their dark hair blonde. She taught them the rosary. She taught them the responses of the Catholic Church. They changed their names and they took on the identity of two Polish Catholics. Now, they were on the farm working one day and they heard that the Germans were coming. So they asked the farmer to hide them, which he agreed. But when they went to thank him, he said, "Don't think I like you Jews, but I need your labor." They then came back to Warsaw and began a fearful odyssey of hiding in Warsaw's cellars and secret passages and rooms, paying money to be protected. And they lived like this in fear of discovery until they were liberated by the Russians in January 1945. Now, my parents met and they married in my mum was 27, my dad was 35. They married in a joint civil ceremony in December 1947 with my aunt and her husband. My dad was briefly arrested by the NKVD. They hadn't forgotten that prison sentence. He felt his post was being disturbed. His phone was being tapped. They knew they had to leave. they had no documents. They'd lost everything, but they applied for copied birth certificates. And I have to say, their marriage certificate, my mum, my aunt, and my uncle all got married as Polish Catholics. My dad was the only one who hadn't changed his name because he'd been in Russia. Now, they left Poland illegally using false passports. They traveled from Warsaw to Prague and then to Paris, where they arrived in 1948. In 1949, they emigrated again, this time to England, to Newcastle upon Tyne, which is where I was born and where they could live in safety and security. My uncle Marek had found them through the Red Cross. He got my dad a work permit, and that's how they ended up in Newcastle. Now, the Nazis tried to kill every Jewish person in Europe. My mum is one of 4% who survived in Poland under German occupation. My dad is one of 6% who survived in Russia or out of Poland. Their legacy is their 2 grandchildren, my children, who are now adults, and between them have 5 children of their own, the great-grandchildren of Jan and Lola. You know, I knew very little about my Polish family. I had to do a huge amount of research in order to give any sort of presentation. And every time I speak, I stress why oral memories handed down the generations are so important. And everyone must try and remember to talk to the older members of our families to learn our history before it is too late. You know, my parents were lucky to survive, but they created opportunities. They looked for where they could increase their luck and improve their situation. And I'm so proud of how they use their intelligence to maximize their chances of survival. Thank you for listening.
Thank you very much, Noreen, for sharing a story of courage, of resilience, of perseverance, but most importantly, of triumph, of your family, of you being with us today and telling that story. I think as you were talking, especially about the time in the ghetto, if we go back to the framework of rights, not having access to food has disproportionate impact on how diseases affect people. And just from your story and from the millions of stories of other survivors, the conditions, the lack of clinics or any medical support, and the starvation took their toll. Not that I think that if a right to health existed during the Holocaust, it would have made a difference to the Nazis. But I do think that a right to health today should and can make a difference to the lives of so many others. And so I'm delighted to invite you, Katrin, now to share with us about what does it mean in today's time not to have access to health, and what does access to health care actually look like if it were enshrined and available.
Thank you so much. Right, just bear with me as I do the clunky bit of sharing my presentation. Can everyone see my slides? Perfect, great. Thank you so much for inviting me. And thank you, Noreen, as well, for that incredibly powerful presentation, actually. And I'm quite reluctant to speak after you now, having heard you speak and to share those thoughts and I guess the lessons and thinking that you're passing on with that as well. So thank you very much. So my name's Katrin. I'm the strategic lead on the right to health at Just Fair. For those of you that don't know Just Fair, we're a very small UK civil society organisation that aims to achieve lasting positive change through the promotion and protection of economic, social and cultural rights. In essence, we often describe economic, social and cultural rights as the kind of foundations or the building blocks of what is needed to create a kind of equitable, fair society where everyone can live in dignity. So really key provisions like housing, like access to food, like access to health. And our vision is to promote economic and social cultural rights and incorporation of those rights in order to achieve a fair and more just society where everyone can live in dignity. And our real mission is to lead and inspire action so that these rights are fully respected and protected and fulfilled across the UK by being incorporated into domestic law. But we're also a hub for economic and social cultural rights in the UK in terms of civil society. So we chair a UK network of charities, community groups, academics, individuals, all working together to share knowledge and expertise on economic, social, cultural rights and to work collectively to achieve change. And today, what I wanted to do was to talk a bit more about what we actually mean by the right to health. But to do that, we also need to think about history and where that right came from. It's really important to sort of ground our understanding of the right to health by how it was intended when it was first formulated, and then think about what that means now, but also in the future. I will look at how the right to health is protected in law in the UK and doing a bit of a health check on what the status of the right to health is today here in the UK, before finally thinking about how we ourselves can advocate for the right to health. And then posing a bit of a question or a reflection for you to think about what the right to health might look like for future generations as well. But before I talk specifically about the right to health, I just wanted to centre things on human rights more widely. I think often we all have lots of different understandings of human rights, and human rights mean different things to different people. But there are some real key concepts that are really important to sort of have clear in your mind when you're thinking about human rights. And human rights are very, very much linked to key principles such as dignity, equality, fairness, and respect. So really key values around how we want society to be, how we want to be treated ourselves, and how we hope other people are treated too. Another key concept is the universality of human rights. Human rights are universal. They are for all of us, no matter who we are. And that is one of the most powerful things about human rights, but also sometimes one of the most problematic, because you can find difficult conversations where different people have different beliefs around who should have rights, who shouldn't have rights. Sometimes we kind of get the impression, perhaps from policy making, that there are those who are more deserving of rights and those who are not. But the core concept is that rights are for everyone. And if we think about the history of rights, this is all about making sure that states don't get to choose who does and who doesn't have rights. They are protections for all of us. That is the benchmark. We should all enjoy our rights without discrimination. That doesn't mean that always happens, but that's the kind of key aim of rights. And sometimes our rights can be restricted, but there are frameworks to kind of work through that. And that's because human rights are also protected by a range of laws. And those laws provide kind of key ways for us to hold the state to account about our rights. Because the other key thing about human rights is that they are all about how to hold the state to account. So they're not about our private kind of individual relationships, but they are the rule book for how the state should be treating its citizens and what we should expect from the state. So it's all about that balance of power. And then the final kind of two things to think about is this interdependency of rights. There isn't really a hierarchy of rights, and especially for economic, social and cultural rights, we need all rights to be realised so that the rights kind of work as they're intended. So, for example, we can't truly access our right to health if we don't have access to appropriate housing, if we don't have access to healthy, nutritious food, then those things are going to impact on our ability to have the best possible health that we can. And then finally, human rights are really important frameworks to help us discuss difficult things, to help us look at policy, analyse policy, and work together to collectively achieve change and to ensure that rights are being looked after and respected and protected and fulfilled. So in terms of the right to health, it's always really good to think about where did our kind of first concepts and ideas come from in terms of rights. And I just kind of want to say that I'm going to be framing this in a kind of post-Second World War, post-Holocaust context. It is important to note there are kind of wider discourses around human rights which start tracing the development of rights at a much earlier stage and look at colonization as well. But for this context, this is the kind of framing that I'm going to use. And in a post-World War situation, you know, we have states coming together, people coming together to think about how do we stop this from happening again? How do we create conditions for people to live in dignity and peace? And recognizing that in order for that to happen, there really need to be key protections to ensure that people can live in dignity and can really thrive. In terms of health, in 1946, you have the World Health Organization, which was founded then. And they, in their constitution, started really to formulate this idea of the right to health. And they described it as the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. And then in terms of those international frameworks, right to health starts to become embedded. So in 1948, we have the Universal Declaration of Human Rights, which we've already heard about. And then we kind of have a series of international treaties that are a little bit more specific. And in one of those, the International Covenant on Economic, Social and Cultural Rights, also known as ICESCA, the right to health was formally embedded and protected in 1966. And that covenant was ratified by the UK in 1976, which meant it has an international duty to think about and to protect our right to health. So it doesn't put the right to health into domestic law, but it has international duties under these international frameworks. And then just a moment to reflect on that law aspect a little bit more. So thinking about our international, but also our domestic protections. So ICESCA, the International Covenant on Economic, Social and Cultural Rights, embeds the right to health under Article 12 in international law. And the UK has to protect this right, it has to fulfill this right, it has to respect this right. But it's not part of our domestic law, so we don't have that sort of domestic route to accountability. However, the UK government still has to report to the UN on what it's doing to protect this right and to fulfill and promote this right in the UK. And that also applies to Scotland, Wales and Northern Ireland. Although it's important to note that countries like Wales and Scotland are already making a lot of progress on incorporating some of the UN human rights treaties and the economic, social and cultural rights. And other international conventions also protect the right to health, like the Convention on the Rights of People with Disabilities, but that's a topic for another day. And then domestically, it's important just to think about the Human Rights Act, which takes the rights from the European Convention on Human Rights into UK law. So it provides us with that domestic accountability route. It doesn't include the right to health. It doesn't really include economic, social and cultural rights hugely. But there are key rights in the Human Rights Act that really impact on our right to health. So things around dignity, autonomy, choice, the right to have a say about what happens to our bodies, the right not to be discriminated against. So there are avenues to access your right to health in domestic law, but there's no kind of domestic protection for the right to health in that kind of same way. So in terms of the actual right to health, which is protected by Article 12 of ICESCA, the kind of key idea of the right to health is that everyone has the right to the highest possible standard of health. So this essentially means that we should all have access to the healthcare services that we need, but it's not just about providing healthcare services. Those services have to be available, accessible, acceptable, and of the highest possible quality for everyone. So when we're thinking about different people's experiences of healthcare service, we're thinking, are those healthcare services equally available in a kind of rural village as they are in a big city? What are the adaptations that are being made to make sure that health services are appropriate for different community groups, different cultural needs, different ages? How is information being presented? Are appointments available in different formats, maybe online? Are staff trained? Are there enough staff? So all these things kind of go into our understanding of what a kind of good quality healthcare service would be. And then it also places a duty on the government to shape the conditions for the best possible health. So really thinking about the underlying determinants of health. So looking at things like housing, food, fair working conditions, all the things that shape how we live and whether we're really able to thrive or not. And when international kind of frameworks are drawn up, there's often additional information to help us understand what was really intended by that framework or by those rights. And in something called General Comment 14, the UN sort of elaborates a bit more about what the right to health is and what it isn't. And it's really important to remember here that the right to health is not to be understood as the right to be healthy. It's too much to expect the state to say everyone is healthy, we're going to make everyone healthy. And it's quite complex, really. Health means very different things to different people, but it's about showing progress to create access to this kind of best possible health. But also, interestingly, the right to health contains both freedoms and entitlements. And those freedoms are really key when we're thinking about this idea of dignity and well-being. So these protect things like the right to have a say over your own health and body, the right to be free from torture, but also the right to be free from medical treatment without your consent. And those freedoms also map quite nicely onto the specific rights in the Human Rights Act, which would also help you to access that. And then in general, it creates this entitlement that everyone should have access to the highest attainable level of health. And already I want you to start thinking about whether you think that's something that we have here in the UK. So you might be thinking, well, if the government hasn't incorporated this into UK law, what does the government actually have to do about the right to health then? And the answer is it does still have to do things. It's still reporting to the UN. It's still showing that it's meeting this right, or it should be showing that. So ratifying this treaty means that the UK government has to take steps towards realising the right to health. So showing that it's constantly developing and improving our access to healthcare services. And it's addressing things like health inequity. It's addressing things like discrimination that impact on our health. It needs to show that it's using the maximum available resources to progress the right to health. So showing that it's adequately funding our healthcare services, but other things that impact on health. And it also needs to show that it's not rolling back on rights, so it's not going back on anything. It's always making progress. And this idea of progressive realization, showing continuous progress towards realizing the right to health, is really, really important, especially if we're thinking about this idea of generations, which is the theme of today. If we think about how health looks like now, but also what do we want the health of our children to look like? What do we want future generations to really experience under the right to health? Theoretically, in the future, generations should have far better access to the right to health, because we have this progressive realization. So you're making policies, you're funding things now which have long-term impact on that right to health. And again, we might want to ask ourselves if we think that that's really happening here in the UK. So what does the right to health look like in the UK today? People often say to me, I'm not really sure what you're kind of doing on the right to health, because we have the NHS, so we have a healthcare service. Surely we have a right to health by the provision of this service. And yes, the NHS is a brilliant thing. We're very lucky to have it, but providing healthcare services alone doesn't meet the right to health. As I said, those services have to be of good quality. They have to be suitable for all sorts of different types of people. They have to make sure they're not excluding specific communities. They need to be available to everyone. And I think if we think about health services today, there are lots of areas where things could be better. And again, we also have this idea of addressing the wider determinants of health. And if we think about the UK today, there are certain things that are starting to sound the alarm that all is not well with the right to health. For example, healthy life expectancy in the UK has fallen. So this is the time in which we live a healthy life, and that is falling very sharply in comparison to other nations with a kind of similar budget to our own. And that's a really, really strong sign that things are not progressing well if healthy life expectancy is not just stalling but falling. And in the same kind of set of data around this, it's showing really significant health inequalities in the UK. And there's a gap in healthy life expectancy between the most and least deprived communities in England, which is about 20 years. So your health and how long you live in good health is very much determined by where you live, and your kind of socioeconomic status. So we have a really high level of health inequality here in the UK. And then kind of from that health system aspect, we know that mental health services are under pressure. There's a lot of disparity between children's and adult services. We know that many, many communities experience barriers to healthcare and to the wider conditions that support good health. And I'm sure at René Cassin, you see that very regularly. We have significant concerns about the standard of care in maternity and neonatal services, for example. Lots of reports that came out about that last week. And then we have things like the impacts of poor quality housing on health, impacts around lack of affordable nutritious food for children. There's lots of things going on which make us concerned about the right to health and make the argument for better protections for the right to health, so that we can kind of make joined up policies that look at health overall. And so at Just Fair, we're working hard to advocate for the right to health. Ideally, we want that right to be incorporated in UK law, but we also recognise that we're quite far from that. We're living in a time where we're trying to keep the human rights protections that we already have, whilst also advocating for more. And that's a very challenging space to be in. But we very much believe that that is what needs to happen. But in the meantime, we're trying to find all of the spaces we can to advocate for and also embed rights-based approaches to health. So, for example, we are holding the government to account around their responsibilities, and we do that through parliamentary engagement. So we reply to calls for evidence and consultations by bringing a right to health-based perspective in our responses. We seek to influence relevant bills. So there's a health bill going through Parliament right now, which hands a lot of power back to the Secretary of State from NHS England. And we're asking questions again from a future generation point around how that might put the NHS at risk of politicisation, of how it might be changed in the future under a different government. And we also make sure that lived experience is embedded into policy discussions, and then generally kind of building the capacity of MPs and Lords to advocate for economic, social and cultural rights. We work with community organisations, and we work together with civil society to start really capacity building on the right to health, so that we can collectively advocate for it, but that also different communities are able to sort of really shape that in a way that matches their work and what's right for them. But it's not just Fair that has to work on the right to health or can advocate on the right to health. We all can advocate for the right to health in the UK. And we can do that by using human rights language and specifically talking about our right to health. We don't need to be legal experts to do this. You don't need a degree. You don't need to be a lawyer. It's okay to start using that language. These are your rights. It's okay to claim them. And it's fine for us to ask questions to policymakers and ask them, how have you thought about rights? How have you thought about the right to health? And we can use that sort of rights-based understanding to look at policies and decisions and ask questions about rights. And we can ask about how lived experience has been thought about, how community groups have been involved. And we can also gather evidence and use this to support civil society organisations that are reporting to the UN about what the UK is doing on the right to health as well. And when you get these slides in the future, you can see some links about how you might be able to do that. And then finally, just some kind of final thoughts for you to take with you. These protections for the right to health were developed in the past by previous generations, but they were protections for the future. They weren't immediately going to change everything. And the whole idea about rights is that they progressively get better. And those rights were relevant then, they're relevant now, but they also need to be relevant in the future. And we need to think about how we protect these protections for the future. And the key principle around the right to health is that everyone has that right to the highest possible standard of health and to live in the conditions in which they can thrive. So for us, we need to think about, are we close to achieving this aim, these principles? And if we're not, what are the barriers to that and how can we change them? And how do we defend and embed the right to health so that future generations also have access to its protections? Because if we don't think about these things now, they might not be there for the future. And I'll leave it there, and my contact details are there if anyone has any questions or wants to get in touch in the future. Thank you.
Thank you, Katrin. That was phenomenal. As you were speaking and towards the end, it reminded me that Eleanor Roosevelt, who was the driving force behind Monsieur Cassin and the drafting of the Universal Declaration of Human Rights. On the 10th anniversary of the Declaration, gave a very important speech, and I'm going to paraphrase and very much summarize what she said. But she basically said, human rights have no meaning unless they're enjoyed by ordinary people living ordinary lives. If it's in our communities, if it's in our local GP clinics, if it's in our supermarkets, making sure that we have access to the fundamental basics that we need. And it doesn't get more basic than health. So really, thank you very much. We probably have 2 to 5 minutes if anyone has a question to either Katrin or Noreen on anything that you've heard. I'll also just say that René Cassin is a partner and a member of the UK's network for promoting socioeconomic rights. And one of the things that we do is through the Jewish Everyday Rights Forum that we helped set up is basically play 2 roles. One is bringing the knowledge of socioeconomic rights, including the right to health, to the Jewish community, communal organizations and members and communities. And I'm glad to see here on screen some members of our Jewish Everyday Rights Forum. But it's also about bringing Jewish case studies to mainstream debate, because there are cases that are unique to a faith-based community. There are cases that are unique to a community that, like some others, is facing increasing hate that might have impacts on accessing health. So really important work. If you or any of the organizations that you are involved in would like to join, please feel free and let us know. I don't see anything on the chat, and I don't see any virtual raised hands. Yes, Margaret, a member of our Jewish Everyday Rights Forum. Thank you. Let me unmute you. You have to unmute yourself, Margaret. You should be able to do that.
Yep.
Yeah.
Great. Thank you. First of all, thank you. I was actually just typing something in the chat, but it's better set. Thank you very much for both talks. Very moving and important. I just wondered, in terms of the NHS, though, am I right in thinking that a significant number of people are denied access to the NHS because payment is demanded, for example, from certain immigrants and asylum seekers whose appeals have exhausted, for example? So even to people within the UK, NHS care isn't free at the point of access?
Shall I reply? Shall I go? Yeah. Yes, you're completely right, Margaret, that even though the NHS is supposed to be free at the point of access, that there are a lot of complexities around asylum and immigration, and also a lot of misunderstandings around who can access NHS provisions. So yes, there's a whole wider debate there around a big barrier to the right to health for people within the UK, based on some of those rules, and also based sometimes on lack of understanding from specific departments as well. But yes, it's a very good point, and it's one of the many things to think about in terms of whether that right to health is being accessed by all of us. There are lots of things to unpick there.
Any other questions? So I'm gonna obviously start by thanking Noreen and Katrin for taking the time and sharing your knowledge and your story. And I try to pull out themes that cut across both your presentations. And it was the value of the individual. At the end of the day, it's about the individual who's at the center of a discriminatory policy, or an attempt to destroy an entire people, but it starts with the individual. It's a story of courage and resilience, facing difficulties, whether it's literally getting access to your GP clinic so you can get an appointment, or certainly what Noreen, your parents and so many other Holocaust survivors experienced during the Holocaust. It's about the challenge of progressive realization. So whether it's the right to health or the right not to be persecuted and experience the type of hate that was experienced 80 years ago, is something that cuts across. And I think should be our legacy to the next generation. It should be a peoplehood legacy, it should be a personal legacy, but it also should be the legacy of us as citizens of the UK. And this is what we want and should aim for. So we need to roll our sleeves up, challenge government, challenge policies, continue telling our stories. And I would be very happy for you to see René Cassin as that platform where you can take your personal experience, where you can take your motivation, and certainly when it comes to access to health, access to everyday rights, the right not to be discriminated against, or the right not to be a victim of hate. Please see René Cassin as that space. Sign up to our newsletter, become a supporter, financial and other. Come to our events. The next event in this series of Lessons Across Generations is on the issue of access to housing. That will be right after Sukkot, so very much the Jewish emphasis on the role of shelter and what it means when you don't have access to shelter and protection, or are forced to leave your home, just as Jacqueline Lux's grandmother had to during World War II, and so many people in the UK today that don't have access to adequate housing and safe shelter. I hope Leslie would have been proud of today as she was. I'm sure she would have been proud. And I think we did Leslie proud. So thank you very much, Katrin. Thank you very much, Noreen. And I wish you all a lovely evening and a good rest of the week. And thank you very much for joining us.
Thank you, Mia.
Thank you.
Good night, everyone.